Hello. Today I will share with you a very special and instructive case story from my clinical practice. This story once again shows us how vital pregnancy follow-up and accurate information truly are. This frame, the one you see on the screen, was taken exactly 11 years ago. I took this photo during the cesarean operation of a pregnant woman at 36 weeks. Even though our patient, that is the expectant mother, had regular pregnancy checkups before, she had no idea about the fibroids. Imagine for 36 weeks this fibroid continued to grow silently in the uterus. Our pregnant patient told us that the baby's position was breech and that preterm labor had started. Of course, since the baby was breech and labor had started, we performed a cesarean section, and that's when we unexpectedly encountered this fibroid. Of course, this is a very old photo. We saw this fibroid during the operation, so we were surprised as well. But this explains everything, because it was this fibroid that caused the baby to be in a breech position inside. And it was also because of this fibroid that preterm labor occurred. As you can see, this large mass in front of the baby is actually a fibroid embedded in the uterine wall. So what is the role of this fibroid in our story? Its position and size prevented the baby from turning and caused the breech presentation. Unfortunately, the breech presentation led to our patient giving birth early at the 36th week and having a cesarean section. So what does this case actually show us? It shows that fibroids can be overlooked even in the best pregnancy follow-ups. That's why things like this can happen during ultrasounds performed in pregnancy. This doesn't mean that fibroids shouldn't be monitored. On the contrary, it's very important for every woman planning a pregnancy to have regular ultrasounds both before and during pregnancy. So actually, an ultrasound should be done before pregnancy. Of course, not every fibroid is this problematic. In other words, we've had patients in the past who had several fibroids and still went through pregnancy without any problems. And it still happens. However, this case shows us the following. Because of their location and size, fibroids can lead to preterm birth, placental problems, increased rates of cesarean section, and even bleeding. They can also cause miscarriages. As a team in our clinic, we always advise our patients to get checked before becoming pregnant in order to detect these situations in advance. We perform advanced ultrasonography. If you are also planning a pregnancy, in order to have a healthy pregnancy with proper planning and follow-up, it is absolutely essential that you are evaluated beforehand. Remember, every patient is unique, every story is different, just like this mother's story. That's why you should avoid making generalizations. I always recommend getting an expert opinion tailored to the individual.